The Ministry of Health has expressed concerns about people failing to complete the second and third doses of hepatitis B vaccination. Statistics from the ministry show that 90% of the infected people do not know their status because they do not show any signs of sickness. Kenneth Kabagambe, the founding executive director for the National Organization of People Living with Hepatitis B, explains more in this report.
Most of the resources were pushed to procurement of vaccines, test kits, but they left the component of community mobilization, sensitization, which was actually the first thing to be done even before the vaccines were brought to those places where they were taken. So we still have low levels of awareness. That's why you see people reluctantly going back to the hospitals, to the health facilities to get their second doses and third doses.
But who is to blame for this problem, and how come most people do not know about the disease and its dangers?
Ebiseera ebyo tetwalinawo obulwadde bwa kika ekyo oba kyetwandisa infection ey'ekika ekyo. Ebirwadde bye twalina nga ndowooza yalinga kolera, ebigenge, ebintu eby'ekika ekyo ne TB. Naye kati mu kaseera kano mu myaka gino egiweddeko emabega tutandise okuwulira nti waliwo ekintu nga hepatitis B.
Ewaffe mu busawo baba balina okukukebera oba oyina. If you are negative, then they immunize you. Okubeera safe kubanga ogenda beera exposure ku balwadde abalina hepatitis B mu ddwaliro.
Emmanuel Ainebyona, the ministry spokesperson, says more effort is now being put in sensitization of the public about the need to go for testing and completing their doses.
So the first turn-up did well because people had experienced either they had lost loved ones, people were so active and they were able to be tested and also get vaccinated. So we had 91.7% of the uptake. The second dose declined a bit and was at 68%, and the third dose further declined and stood at 33%.
There is nothing that can be successful if the patients are not involved. Yeah, because all programs are meant to better their lives. So if you don't include them at the starting point of the program design, then there is nothing that belongs to them without involving them. Yeah.
Rachel Kentenyinji, Group 3 Broadcast Journalism class.